Hey, welcome to Socialism for All. Today's date is March 21st, 2022, and in this video, we're going to take a look at an article from The Atlantic. The title of the video is "The Biden Administration Killed America's Collective Pandemic Approach." Subtitle, "Protections Meant to Shield Everyone Can't Be a Matter of Personal Preference," by Catherine J. Wu. If you like this video, please click like and subscribe, and consider supporting on Patreon at patreon.com/Socialism for All. You can find a link to the Patreon in the video description. So the last video that I put up on the channel just a couple of days ago was a COVID update, which basically talked about how the Omicron subvariant BA.2, the Omicron we've already had was BA.1. Actually, there's a couple of different strains of BA.1, but basically there's a different strain, which is not a child of BA.1, more like a co-evolved cousin or sibling. So the cross immunity is not necessarily what you might hope it would be. People may be getting reinfected. That's going on in Europe now and in Asia as well. And it's looking like there's probably in about 2 or 3 weeks going to be a big surge here in the US. I don't know when the actual peak will be, but I think that we're going to start seeing basically all through April, some pretty significant surging going on as far as the pandemic goes again. I covered as well the changing CDC goalposts of risk assessment. Go check that out if you haven't already. Basically, this article I broke off for this addendum as a follow-up video because I thought that it would just pay to kind of focus on this a little bit more. As I said in that previous video, the Democrats and the Biden administration have been far worse on the pandemic than even I was expecting. I really wasn't expecting good things, but I mean, the way that they were running against, the Republicans don't believe in science and this and that, just like climate denial, the Republicans have their very overt version, and then the Democrats have theirs. The Democratic Party, captured by big business a long time ago, it's not coming back. They're funded by the same, Goldman Sachs and other Wall Street entities that the Republican Party is. There's a little bit of difference in terms of who funds them, but not really in terms of the class of the people who fund them. And as we know, class conflict is the fundamental basis of everything that happens in society. So you have two parties that are controlled by finance capital, and that's about that. This also isn't specific to the United States. We see these same kinds of countries abandoning any kind of mitigation efforts for the pandemic all across Western Europe, all the imperialist countries. This is a directive obviously coming from international capital. It's not specific to any one particular country, although each country is going to implement it in its own way, and every country has sort of its own amount of counterpower from the working class pushing back on it, demanding greater protections and things like that. That situation is going to be a little bit different in every locality. Overall, though, it is clear that capital wants to be done, and they are mobilizing all of their political representatives to try to put this message out. So back to the title of this article again, the Biden administration killed America's collective pandemic approach. You can't take a personal, oh, maybe you like wearing a mask and I don't. Yeah, that's not really how it works in a pandemic, transmissible illness, contagious disease kind of scenario. You can't just rely on who feels like doing what. So we've covered COVID quite a lot here at Socialism for All. Back in January, I did like 13 videos in a row. One of those videos was Jeff Zients, the COVID response czar for Joe Biden. Who is Jeff Zients? He's a Bain Capital guy. The place where Mitt Romney worked, that Obama ran against, basically, in 2012. Yeah, that's who's directing COVID response for the United States. Does he have any background in medicine or public health? No, he does not. He has a background in corporate rating. That's it. So that's who's running the U.S.'s COVID response at the federal level. So let's get into this article now. This is dated March 2, 2022. This time last week, nearly all Americans were still being urged by the nation's leadership to please keep those darn masks on. Comment, actually, they had done mask or vax back in May 2021. This was an absolute disaster. This was a can't put the toothpaste back in the tube kind of scenario. Once you tell people that, everyone's going to take their masks off. And in fact, that's what actually happened. They tried to get people to put them back on somewhat during Delta and then during Omicron this past winter. But, you can't just flip your strategy back and forth with regard to masks. Transmission needs to be stopped, okay? That's the bottom line. Vaccines are good for reducing symptoms, and to a certain extent, after the first week of infection, they do help the immune system to get rid of the virus more effectively by priming the immune system to deal with it. However, viral load in the first week, from what I've seen, is pretty comparable. So what do you need to do there? Masks, social distancing, shutdowns to stop transmission, keep the virus from hopping to body and reproducing itself. That's the bottom line here. So yeah, as far as keeping the masks on, the messaging had already been bad for 8 or 9 months at that point, but now we're at the point 10 months after mask or vax where, everybody's just ready to burn the masks. But anyway, continuing. Then the Great American Unmasking Part 2 began. On Friday, the CDC debuted a new set of COVID-19 guidelines that greenlit roughly 70% of us. Effectively, anyone living in a place where hospitals are not being actively overrun by the coronavirus, to doff our masks in most indoor public settings. Comment, this was basically the second point, the CDC goalpost moving that I referenced. If you haven't watched that update, please go check it out. Continuing. The stamina of mask policy had been flagging for quite some time. Governors and mayors had already been weeks deep into vanishing their own mask mandates and other pandemic precautions, including in schools. But the CDC's decision still marks a substantial cross-continental change, delivering a final blow to what little remained of the country's collective approach to quashing the pandemic. In the new playbook, recommendations for individual people, not communities, sit front and center, and mitigation frequently falls under the purview of medicine rather than public health, heaping more responsibility on the already dysfunctional American healthcare system. Quote, "It is public health's job to protect everybody, not just those who are vaccinated, not just those who are healthy," says Teresa Chappell-Magruder, the director of the Department of Public Health in Oak Park, Illinois. I asked Chappell-Magruder if the CDC's new guidelines meet that mark. Quote, "Not at all," she said. The CDC did not respond to a request for comment. Throughout the pandemic, U.S. American leaders have given individuals more responsibility for keeping themselves safe than might be ideal. These revised guidelines codify that approach more openly than ever before. Each of us has yet again been tasked with controlling our own version of the pandemic on our own terms. Quote, "The onus of public health measures has really shifted away from public and towards vulnerable individuals." Ramnath Subaraman, an infectious disease physician and epidemiologist at Tufts University, told me. In his State of the Union address, President Joe Biden said, quote, "We're leaving no one behind or ignoring anyone's needs as we move forward." Okay, that's one way to talk about it. And the White House has said that it will release a new pandemic strategy today. The CDC's recommendations, too, say that they've been written to prioritize, quote, "protecting those at highest risk of severe outcomes." But in their details, several experts told me, is the exact opposite message. Those most susceptible to serious cases of COVID-19, those who have borne the virus's burden the most, are now being asked to bear another load more. This particular moment is arguably a reasonable one in which to shift the national stance. Coronavirus case numbers are in free fall. Vaccines, and to a lesser degree, viral infections, have built up a wall of immunity that can blunt the virus's impact overall. I need to comment there. This is blatantly untrue. So while I think this article has the overall right approach to criticizing the shift from a public collective response to the pandemic onto, an individual one where it's just like, talk with your doctor if you have a pre-existing condition. By the way, 85% of the public has a pre-existing condition, since it includes things like any mental illness and being overweight or obese, and 73% of the United States population is overweight or obese. So anyway, but Yeah, as far as being a reasonable one to shift the national stance, not at all. Coronavirus numbers are in free fall now, down from the biggest peak by far of any wave of the pandemic. And in some areas, it's not even down below the pre Delta numbers yet. So, not at all. Plus, we can see coming from Europe that there's a big problem. Now, this article is from almost 3 weeks ago as I'm reading it today on the 21st. Still, this whole idea that we're not going to get new variants and new waves, bullshit. I mean, it's utterly, utterly wrong. And as far as the idea of vaccines and to a lesser degree viral infections, I wouldn't actually say to a lesser degree in terms of the protection given, maybe to a lesser degree in terms of who has had them, viral infections. Yeah, it does build up a wall of immunity, but that also wanes, whether it's natural immunity or whether it's from the vaccine, that fades. 4 or 5 months later, you're back to being pretty vulnerable again. So big pushback there from me. I don't think that it is a reasonable one at all. Continuing. Several experts stressed that certain aspects of the CDC's new guidelines are genuinely improving on the framework the country was using before. Quote, the timing feels right to make some kind of change, Whitney Robinson, an epidemiologist at Duke University, told me. Commenting again, I don't know exactly where Whitney Robinson is coming from. It doesn't feel right to me at all, particularly with the BA2 wave that we've been able to see coming for some time. Let me add, though, one of the notes that I added in the pinned comment on the COVID update from a few days ago was that, one of the things that the CDC did was they had their community transmission map. This is the one that went blue, yellow, orange, red. And a lot of the time recently it's been at red. And then they made a new standard of like community risk. I forget what the name for it is, where it's just green, yellow, red. And they substantially it boggles the mind. The bar for what is considered low risk is now twice as high as the old standard for high risk. So it's pretty crazy. Like they basically just really raised the threshold on what qualifies as something to be concerned about at all. Now, the thing that I said in my qualification is that I could understand developing another kind of guideline for people in county or state government to be able to assess the kind of risk that their communities are exposed to on a county by county basis in terms of, do we have enough hospital beds? Because, for example, the for-profit medical system likes to run at capacity so that it's profitable. So they're always getting rid of beds and things like that. And, there are other things. What's the vaccination level like and so forth? Actually, I'm not sure that one's in there. But in other words, I can see the benefits of having a different measure that tells you, if something were to go bad, is your county prepared to do it? That's really different, though, and should never take the place of a different, community transmission standard, for example, that tells you whether it's safe to take your mask off or not. Those are completely different things for completely different purposes and completely different audiences. And yet it's kind of being billed as a replacement. They're not getting rid of the old one, but there's an effort to kind of forget that that is a thing. So that's my objection. Anyway, continuing. But protection against SARS coronavirus 2, or COVID-19, isn't spread equally. Millions of kids under 5 are still ineligible for shots. Vaccine effectiveness declines faster in older individuals and is patchy to begin with in many immunocompromised people. The chances of serious illness go up in high exposure settings too, and the CDC's list of COVID risky health conditions remains long. The pandemic has also, since its early days, disproportionately pummeled communities of color and people in low income brackets, structural inequities that big nationwide trends can easily obscure. The CDC's new stance on mitigation glosses over all of that, Julia Raifman, a policy expert at Boston University, told me. In her ideal, the country might turn off mask mandates while making clear that they could turn them back on if the community threat levels warrant it. Mandates are tough to tolerate in the long term. I just, again, have to object. It's a mask. aside from restaurants, which granted are fairly substantial, it's not actually that disruptive, and to restaurants because it covers your mouth where you're going there to eat. But other than that, it's a mask. Deal with it. It's a pandemic. It comes along once in a century. Like, I'm sorry that, you're unfortunate enough to be living through it rather than in other parts of the century that are not, having a pandemic. But seriously. Anyway, going on. Mandates are tough to tolerate in the long term, but maybe enough U.S. Americans are still on board. A smattering of recent polls suggests that a slight majority of U.S. residents still favor certain pandemic caliber protections while the virus continues to run rampant. Again, just commenting, we just had the worst wave by far. It was about 3.5 times worse than last winter's wave. This thing is not over. That is sheer wishful thinking. And there's a wave going on again, BA2, in Europe and Asia right now. And we know that that precedes the US by a few weeks. That's what always happens. But anyway, as far as this stat that a smattering of recent polls suggest that a slight majority of US residents favor the protections, guess what? If you break that down by different demographics, lower income people more likely to want mask mandates and things like that, and also by race, white people less likely to favor protection. So basically, if you are rich and or you are white, less likely to want protections. So again, the wealthier, whiter you are, the more likely you're probably in favor, statistically, of wanting to tear down these protections. Continuing. So maybe the CDC swung the pendulum too far in the other direction, experts told me. Again, time out here. I like, this writer has an engaging style, but I think that they're playing a little bit too fast and loose with the metaphors here. This isn't really about pendulum swing at all. Anyway, continuing. The agency also updated its risk guidelines to focus primarily on hospital burden rather than local transmission alone. By the old metrics, nearly all U.S. counties should be masking, but under the new standards, that recommendation applies to only about 37%, designated orange on the agency's map at a, quote, high COVID-19 community level. In another 23% of counties, at the low green-colored level, no one needs to mask. Smack in between, in the 40% of U.S. counties currently at the medium yellow-colored level, some people, if they're, quote, high risk or immunocompromised, maybe should. The CDC's best advice to those people, quote, talk to your healthcare provider, comment, assuming you have one, about whether you need to wear a mask and take other precautions, e.g. testing, unquote. That couldn't be more vague. Continuing, Emily Landon, an infectious disease physician at the University of Chicago, told me that she finds the yellow category recommendations wishy-washy at best. As someone who takes immunosuppressive drugs to manage rheumatoid arthritis, she appreciates the nod to the immunocompromised, but she and other experts don't see how many U.S. Americans could follow these guidelines. About a quarter of U.S. residents don't have a primary care provider. Millions are uninsured. And plenty of people with coverage don't have the time or funds to seek professional advice on masking, especially if it requires an in-person visit. Plus, healthcare workers, already overwhelmed, can't afford to be inundated by requests for bespoke masking plans. Comment here again, even if you have a provider, try getting an appointment sometimes. Anyway, Bertha Hidalgo, an epidemiologist at the University of Alabama at Birmingham, also points out that, quote, a lot of people don't trust the healthcare system about masking or anything else and will simply decide not to ask. Medical opinions can't be treated as universal gospel either. She's seen physicians in her state advocate against masking in crowded settings. A medical framework, almost resembling a prescription model, is not public health guidance, which centers community-level benefits achieved through community-level action. People act in the collective interest, a tactic that benefits everyone, not just themselves. Where the CDC leaves us now feels especially disorienting when we consider where most mask-up messaging began, with the idea that masking was an act of communal good. Quote, my mask protects you, your mask protects me. Now masking is about, as the CDC puts it, quote, personal preference informed by personal level of risk, unquote. Can I just say, That means that the CDC basically is, I mean, denying aerosol transmission. Yes, they are denying aerosol transmission. COVID is airborne. And I mean, the entire conversation that we waged with a lot of difficulty actually about, explaining to people you do not have the right to spread a dangerous disease to other people. That is now out the window. The CDC has completely capitulated to the people who just don't feel like wearing a mask, and therefore, if they have COVID, they're just allowed to spread it, and there's absolutely no official pushback on that. And even wearing a mask, it's good protection, but it's not perfect protection. You can still get COVID in your eye or other, exposed mucous membranes, probably just your eye. But, also sometimes masks fail. People have been wearing them for a while. A strap breaks or the seal isn't holding perfectly or whatever it is, or somebody sneezes on something and then you handle it and then, you rub your eye and then you get COVID that way. But CDC is just like, oh, it's your personal choice. Get a disease, don't get a disease. Spread a disease, don't spread a disease. They're basically, I mean, as COVID gets more and more virulent, like, it's now a different virus than it was. It has mutated substantially. Omicron has more mutations by far than any previous strain. It's becoming something else. Well, they're just like, it's whatever. I mean, it's literally a more dangerous virus now than it was 2 years ago. And CDC is just like, hey, maybe you'll get it, maybe you won't. Continuing, the guidance around diagnostics and other mitigation measures has similar problems. High-risk people are told simply to, quote, have a plan for testing. But tests are still expensive and not always easy to find, disadvantaging already vulnerable communities. That muddies the road to another essential intervention, treatments, such as oral antivirals, which also remain in short supply. Biden last night announced a test-to-treat initiative that could clear some of the hurdles that stand between positive test results and COVID pills, and that addresses some of the issues around drug supply. But the plan still requires most people to seek out diagnostics at pharmacies or community health centers, which aren't easily accessible healthcare venues for many Americans, especially in rural regions. By the way, let's update this article now that we're reading it after last week. This is again from March 2nd. What happened as far as funding for testing, funding for antivirals, stuff like that? The House didn't pass it. They were supposed to pass, or it was up for discussion, a $15.6 billion pandemic response thing that would allow uninsured people to get tested for free and vaccines for free. So now we might not even get boosters for free anymore. That didn't get funded. So all this, test to treat initiatives and whatever, yeah, maybe not. So it just keeps shrinking and shrinking. Continuing, the CDC's guidelines do emphasize the importance of ensuring the, quote, access and equity of crucial pandemic tools, yet they offer few, if any, concrete stepping stones, Tufts Subaraman told me, to pave that path. A better system was possible, experts told me, one that could have allowed us to stretch our pandemic-weary legs while developing strategies to unite communities and better shield them as a cohesive unit. For starters, the categorization scheme could have loosened far less. The new model recommends universal masking at more than double the community case count of the old one, and only if the virus is starting to fill a consequential number of hospital beds. That pushes higher-risk people to mask solo for much longer before anyone else is expected to join in. The vulnerable, in other words, must bear the brunt of the pathogen's burden at the front end of every surge. Quote, asking people to take individual measures to protect themselves is much less effective than whole community interventions. Andrea Ciaranello, a pediatrician at Massachusetts General Hospital, told me. Even close contacts of people who are at high risk are told to merely consider testing or wearing a mask until the healthcare system is once again feeling the coronavirus's crush. The focus on super serious disease also neglects the many consequences of infection that can happen outside of or prior to hospitalization, including long COVID. Massive amounts of less severe disease, too, can overload the healthcare system until it buckles. The goal of blocking transmission, Robinson told me, seems to have fallen off the map. Quote, "It looks like reducing hospital overwhelm is all we're trying to do," she said. Comment, "Thank you, someone, for talking about stopping transmission." That is, without stopping transmission, the virus is eventually going to catch up, outsmart you, come back, have a worse wave. That is what we've been seeing so far. You have to stop transmission because every time the virus gets transmitted and it replicates in somebody's body, that's where mutation happens. You just have to stop that from happening. That, I agree, has disappeared from discourse where it even ever was being discussed. They're not even trying to stop transmission, which suggests that this will be around, getting worse, for years. Landon, of the University of Chicago, said she's okay with flickering masks off somewhere around the new high-medium boundary, when the strain on the healthcare system is starting to ease and population immunity is fairly fresh. I don't really know what to say to that. So going back, this is Emily Landon. She's an infectious disease physician. I don't know that she has that much training in terms of like public health messaging, for example. I mean, again, if we learn anything about turning masks off, it's that people don't want to go back to wearing them again. I mean, the resistance you were already dealing with becomes that much worse. And then there are, casual attacks at a minimum on people who are wearing masks by people who aren't wearing them and are particularly insecure, about people wearing them when they're not. I've had people staring at me. I've heard from many people of comments being made, like aggressive comments, like, people, just random strangers coming up in public and calling them sheep for wearing a mask, obviously wanting some kind of a confrontation. These are just things that, unless you have any kind of background training and understanding group psychology, sociology, how groups of people actually act in society, this isn't just down to like medical technical specs. It's the dynamics of how, group social norms come into and out of existence. So, I don't know really how much to weigh that opinion. In fact, it conflicts with everything that I would, population immunity is fairly fresh. It's just crazy. Anyway, in the old system, she told me, quote, "We were actually keeping on masks too long." What are you talking about? Just qualify that statement. What do you mean keeping masks on too long? What's the downside? Anyway, total nonsense. Continuing, but it's impractical to use the same thresholds on the downswing and the upswing. When cases are hurtling upward, waiting until hospitalizations are shooting up means waiting, quote, "way too long," she said. Yeah, but here's the thing. You're talking about society and trying to introduce rules and then pull back rules, and it just doesn't fucking work like that. So, I don't know. I got to say, I'm starting to get like a little bit of vertigo reading this. Like, these are the people, this is the type of conversation that's going on. It's completely divorced from reality. And I've had COVID. I had long COVID. The effects were devastating. I don't want it again, yet, I need to go out in the world and do things. And I know I'm not alone in that. And, having medical people just like, oh yeah, well, we'll just wait till there's another big spike again. Then we'll tell people to put masks back on, and it will be too late is the thing. Anyway, one recent analysis, for instance, found that by the time, quote, "high-level protections turn on, it would be too late to stop the nation from hitting 1,000 deaths a day." Yeah, I feel like this whole thing is just crazy. I mean, they're not even talking about stopping transmission, meaning all these rules about, oh, got to put your masks back on now. It's always going to be too late. You need to stop the surge from happening at all. Not like once it's on the upswing, try to curb it. No, stop it from going into an upswing in the first place. But, I guess some injuries and deaths, like on a mass level, are just good enough for them. I'm sickened. Continuing, donning masks, an explicitly preventative measure, earlier at the new low to medium transition, for instance, perhaps even before, has a much better chance of dampening a surge. Yeah, never should have taken down the mask mandates. At all, period. And you don't, I mean, this is on the new standards, by the way, which are like double the old high standards. None of this is like based in evidence at all. It's not based in medical reality at all. Not at all. This is for the convenience of capital and just, the back to normal narrative. That's all this is. It has nothing to do with viral transmission whatsoever. There's no end game to this scenario. You will keep getting new mutations and new surges. That is what you get from this. And every time, like, again, Delta was significantly worse, both in transmissibility and in severity, its ability to cause disease, the virulence. Then Omicron came along. Virulence, its ability to cause disease, was about the same, but it was far more transmissible than Delta. And now, BA2, even more transmissible than Omicron, about 30 to 50%. We'll call it 40. So how many more times do you want to keep rolling the dice on these mutations? That's really the question. There's no end game to this. Oh, when there's a surge, put your mask on. We'll pretend we care for 5 minutes. Continuing. Early action would also better safeguard people in high exposure jobs or living situations who can end up imperiled on a wave's leading edge, Rafeman said. Several experts also noted that they wished the CDC had delayed its updates until kids under 5 were eligible for vaccination or effective treatments were widely available. Quote, "We should not be moving forward until everyone has the same opportunity to get vaccinated," Chapel Magruder, who has a 3-year-old daughter, told me. In her version of the playbook, her community would also need to meet a vaccination rate of at least 80 to 85%. Studies modeling infection mitigation in schools, including one led by Cirinello, have found that fewer on-campus measures are needed to keep transmission under control when vaccine uptake is high. There's no explicit vaccination rate requirement in the CDC's new guidance, Sabarman said. That makes it tough to emphasize the importance of vaccine equity as another marker of a community's resilience, he added. Disproportionate dosing runs the risk of concentrating harm in vulnerable groups. And commenting, isn't that really the goal here? Isn't this eugenics? I really don't know how else to explain it. You had outcomes here which were predictable even just as the pandemic was starting up, and then, which of course have played out over time. We're not blindly groping in the dark anymore. We have 2 years of data. They know what's going to happen, and they're doing it anyway. I really fail to see how this can be described as anything but deliberate. Continuing, there's nothing technically stopping individual cities, counties, or states from shooting for higher goals themselves. But now that the CDC has slackened its grip, it's gotten that much harder for everyone else to go stricter, Chapel Magruder said. So commenting, this is what I'm saying about introducing rules in the real world, politics and society. It's not just like, oh, some, medical technocrat like flips a switch somewhere. You have to actually implement it in the real world. This is a lot more complicated. It's a lot stickier. It's a lot messier. So when we go back to when I was outraged 10 months ago, when they did masker vax, May 2021, if you read in the articles that were coming out at that time, all the cities and governors were like, what the fuck? Where is this coming from? No one saw it coming. The CDC just kind of like dropped the surprise bomb on people like, hey, we no longer recommend masking if you're vaccinated. And cities, like, they quoted some mayors and stuff like, what? Like they basically, they dropped it on a Friday, if I recall correctly, which is what you want to do when you don't want your, whatever you're doing to be discussed all week. You drop controversial news that you want to be forgotten on a Friday so that by the time Monday comes around, everybody's moved on to whatever happened over the weekend. But yeah, there were quotes from mayors and stuff like, we got zero notice of this and we don't know what to do. And we don't know any of the rationale behind this, etc. Because there was no rationale behind it, at least any kind of, evidence-based medical public health type of evidence behind it anyway. I mean, the rationale was Capitol has decided we go back to normal now. That's it. So anyway, continuing. Her community, Cook County, Illinois, was marked at high transmission last week. Now, It's a calming green low, and no one has to mask. Most local schools are no longer requiring face coverings either, as of this week. That means that the risk to a vulnerable person, including her unvaccinated child, is that much higher. With these changes, Chapel Magruder has decided that her daughter won't be visiting public indoor venues until she's vaccinated, or until community case rates drop down to the old definition of moderate, fewer than 50 cases per 100,000 people over 7 days. Neither milestone feels terribly close. On Sunday, her family embarked on one final indoor outing together to the grocery store. It will be their last until the forecast clears. That's the end of the article, and that's the kind of situation that people are being put in. Now, as far as the schools no longer requiring masking, it is anecdotal at this point, but I've been hearing from a lot of people around the country on social media, like, this week or last week on Monday, my child's school stopped requiring masking, and only about a quarter of the kids kept masking. And then by the following Friday, almost the entire class was out sick. So these are the consequences. These are the positions that people are being put in. And again, I believe that for reasons stated in the previous article, the wave has already started in Europe and other things. It's BA2 is in certain places, it's basically between like 15 and 35% in different regions of the US, like California, it's higher, and then the Northeast, it's higher. Like basically the coasts are higher. BA2, once it hits 50% prevalence, that's where it starts really taking off. Some areas like the Northeast are at 35, 37%. California, 35%, somewhere around there. Other areas are still lower, but it's growing. It's been growing for 6 weeks. So we can expect another surge in another 2 or 3 weeks, round about that time. So basically April, we can expect BA2 to start getting out of hand. Meanwhile, the CDC is just trying to revise to make everybody think that everything's fine and dandy. It's really not. This won't be the last wave. At least we have absolutely no reason to think that it will. And so we have to plan as if it's going to continue unless we do something different. No disease has ever been stopped by just allowing rampant transmission. That's not how it works. Anyway, that's the end of the article, and that's the end of my comments for now. What do you think? Leave a question or comment in the discussion area below. We'll pick it up there. Otherwise, thanks for listening. There will be more COVID articles coming. I actually grabbed a whole bunch back in February that I have not covered on the channel yet, and I got kind of burnt out on it, plus the whole Ukraine-Russia war popped up, and I can only cover so much in a week, but I may be returning to those articles, hopefully before the BA.2 thing hits, so that, it'll be on people's minds a little bit more. It's a very frustrating, very discouraging, alarming, outrageous set of events going on right now, and I hope you all are doing everything that you can to take care of yourselves, your loved ones, your communities. My thoughts go out to you. And it's at this point that I'll say thanks for listening, and thanks to the current patrons whose names are on the screen. If you'd like to get your name on the screen, head to patreon.com/socialismforall. You can sign up for as little as $2 a month or more, whatever you see fit. Every donation is encouraging. They're also materially helpful. And the support from the patrons have allowed me to do a lot more content than I would have been able to do otherwise. So if you like this channel, thank me, but also thank a patron. Also, liking, sharing, subscribing, and commenting all help to boost the channel, propel it forward in the YouTube algorithm. So even if you just leave random letters or good video or thanks, all of that engagement helps Socialism for All to grow as it has been doing. And it helps more people who are out there looking for answers to questions about what is going on in the world today and what's the basis for all of these historical changes. It helps them to find this content and hopefully get into something a bit more sensible and useful in terms of having a socialist analysis of the world. Thanks again, and we'll catch you in the next video.